has recommended treatment for an autoimmune or inflammatory disease. You may need infusion therapy in a specialized center. Arise Infusion has 5 state-of-the-art centers in the D.C. metropolitan area with highly trained staff who provide safe, comfortable administration of the most advanced medications. Justin Peng is here to tell us more about that. We welcome you to Let's Talk Live.
Thanks.
A little bit of an education here for me, and I believe the viewers at home as well, at least for some. But we hear the word autoimmune disease a lot. What is autoimmune disease?
Right, so what is an autoimmune disease? Basically, your immune system, which is made up of blood cells in your body, normally it protects your body against infections. Like if you have a virus or a bacteria or a cold, we're getting into the season now, your immune system protects your body against these infections. But sometimes the immune system can get confused. It could get dysfunctional, and it could start attacking your own healthy body tissues. And it can cause symptoms like pain, fatigue, inflammation in the joints, swelling, and some of the more common autoimmune conditions you may have heard of are, for instance, lupus, rheumatoid arthritis, multiple sclerosis. There are a number of other less common autoimmune conditions that we treat as well.
So how do you diagnose an autoimmune disease? So
there are a whole spectrum of autoimmune diseases, but let's take rheumatoid arthritis, for example. This is an autoimmune disease where your immune system is overactive and it's attacking your joints, like your hands or your feet or your knees. And the symptoms, most people feel worse with rheumatoid arthritis. They feel worse in the morning, and they sort of get better throughout the day. Now, this is as opposed to the more common type of wear and tear type arthritis, where people get worse throughout the day. And after an injury or if they overuse a joint, they get worse. So we look at different patterns, and sometimes we do blood tests, sometimes we do x-rays, and there's often not one diagnostic test for an autoimmune disease. We try and put all the pieces together and come up with a diagnosis so that we can treat them as soon as possible.
Okay, let's talk about treatment and how do you treat autoimmune disease?
So treating an autoimmune disease really starts with a healthy lifestyle. If we work with patients on diet and exercise. Obvious things like losing weight, avoiding smoking, these have been shown to delay or prevent autoimmune conditions. And then a very important component of treating an autoimmune condition involves finding a medication or a combination of medications to treat this overactive immune system, to try and calm down this overactive immune system. Now, over the years, we've had a number of medications that can do this, but over the last 10 years or so, there's been a significant advancement of a type of medication called Biologic Therapy. And so these medications target a very specific part of the immune system, so we don't get as many side effects as we've had with some of these older medications. The research has also shown that the biologic medications can not only delay the progression of an autoimmune condition, but sometimes even halt the progression of an autoimmune condition. Biologic therapies can come in like a pill, like an oral form. Sometimes they come in injections, like you inject in the skin.
Yeah.
And then sometimes they come in an infusion format, where a nurse puts in an IV and you get the infusion and they monitor you. If it is an infusion route, we often will do it either in a hospital setting or in an outpatient infusion center like ours.
So tell us more about Arise Infusion and where you're located. You said 5 area DC locations.
Right, so we are located in 5 different areas, all in the DC and Maryland metro areas. We've been doing this for over 10 years now. We have very highly experienced nursing staff. Sometimes it can be very intimidating getting an infusion, so we have very friendly nurses that make people feel comfortable. They can be also costly medications, so we have dedicated staff to try and make sure everything is covered. Our main goal really is to get people into remission with the least amount of hassle and to get them back to doing the things they enjoy to do.
Well, this has been a great educational process this morning. I know people at home may be watching and they may want to learn more about Arise Infusion. Where can they go for more information?
So you can go to our website. It's www.washingtonarthritis.com. And we also have a phone number, 301-942-7600. But our website has a lot of content on there, and there are links to Arise Infusion as well.
Awesome. And the phone number on your screen as well. If you have some questions, you can give them a call right now or ariseinfusion.com/ABC7. Justin, thank you so much for coming in. Great to meet you.
Thank you.
And thanks for your time. We're going to have more of Let's Talk Live coming up right after the break.